When should you sign up for Medicare Part B? Or better yet, when shouldn't you sign up for Medicare Part B? That's really more important. So I'm going to go through that right now because I see it too often where it gets messed up. So it's a super important part of Medicare. Medicare A and Medicare B are the foundations of Medicare. So you have to have that to get everything else going, but you have to do it at the right time. So with Medicare Part B, that's the one that you really need to initiate. A will go along with it when you do it. But Medicare Part B, if you're turning 65, you're not working, you're ready to retire, you don't have health insurance, that's all pretty simple. Obviously, you want to start your Medicare Part B and come into Medicare. That's the main time most people do it. It kind of used to be more than it is now, but now if you're working past age 65, which a lot of people do, and you have group health insurance at work and you're going to stay at work for another 2 years, 5 years, 10 years, whatever it may be, you do not want to start your Medicare Part B. And there's a couple of main reasons for that. Is number one, it has a cost to it. So Medicare Part B right now costs about $165 a month. So it's almost $2,000 a year in premium. And if you're at work on group health insurance, Medicare is secondary. So your group health insurance would be primary. So Medicare will not have any value, won't pay anything with your group health insurance. So there's no reason to have it. Now, the other reason you don't want to start it is Medicare Part B is a trigger when you come into Medicare. So let's say you stay at work, you're on your group insurance, you work until you're 68 or 72 or 78, and then you come into Medicare. You're then going to start your Medicare Part B, and it makes it like you're turning 65. You have unlimited choices in Medicare without any medical questions, without any preconditions. You can choose what you want with no questions asked. If you have already started your Medicare Part B previously, and I just had somebody recently that turned 65 10 years ago, stayed at work, but started their Part B when they turned 65. And number one, they paid for it the entire time, which again was of no value to them. And then now that they're ready to come into Medicare, they don't have free choices. They are considered guaranteed issue. So much more limited choices coming into Medicare unless you're healthy. If you're healthy, you can still do whatever you want. But if you're not healthy, you got to get approved. And you don't want to be in that situation when you don't have to be. Number one, you don't want to pay for it for 10 years when you don't need it. And number two, you need it as a trigger so you can do what you want when you come into Medicare. So there's another caveat here with that employer situation. If you're still working, for some reason Medicare puts a line on it, and that line is 20 employees. So if you work for a company with more than 20 employees, then your group insurance is going to be primary. Medicare would be secondary. So Medicare is not going to pay because your group insurance is going to pay. However, if you work for an employer that has 19 or fewer employees, then Medicare is primary and your group insurance would be secondary. So if you work for an employer with less than 19 employees, you want to come into Medicare because that group plan is not going to pay because Medicare will be primary. So, and again, how anybody would know if you work at an employer that has 15 to 25 employees, how they're categorized at that 19 or fewer is difficult. And I don't have any real answers for that, but we will help try and figure it out. But that is where the line is. So if you work for a very small employer, you want to come into Medicare at 65 really regardless, no matter what. If you work for a large employer and you're going to stay on that group insurance, you do not want to come into Medicare. You do not want to start Part B. Now, another little caveat. A lot of times you will have a spouse on your group insurance. If you were the one turning 65 and your spouse is on your insurance, it can be a little complicated. So because number one, you want to keep your spouse covered. If they're less than 65, you want to keep them on your group health insurance. So if your spouse is the one that has group and you're turning 65, you probably want to come off that plan because you're probably paying for that plan. Very few employers pay for the dependent on the group health insurance. So if you're turning 65 and you are the dependent, it's probably a much better deal for you going into Medicare. You'll have much better coverage, at a much lower cost. So make sure you understand that as well. So that kind of clears up Medicare Part B for you. And again, this is what we do. We help make sure we get all the pieces in the right places. Give us a call. Just fill out the form on my website at Medicare on Video, and we'll walk you through everything and make sure we put it all right in place the way that it should be, so you don't have any penalties. You don't pay for things that you don't need. You do exactly the way it's supposed to be, and it's really good when we do it right. So I hope you found this helpful. Stay tuned. I'll show you how to download my book right now. You certainly want to keep that on your iPad or your computer for now and in the future. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit MedicareOnVideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit MedicarePriceCheck.com, put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be, and likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at MedicareOnVideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.